For more than a century, getting vaccinated has usually looked something like this. A needle, a syringe, a trained health worker. But what if getting vaccinated could look like this? Or this? Or even this? These could be the vaccines of the future. Scientists are developing entirely new ways to deliver vaccines, and these innovations could help solve some of the biggest obstacles preventing vaccines from reaching people around the world. First, vaccine patches. These are called microarray patches. They're small, adhesive patches studded with hundreds or even thousands of microscopic projections that painlessly deliver vaccine into the immune cell-rich upper layers of the skin. They're easy to administer and would help people with an aversion to needles. But the truly revolutionary part is what these patches could mean for vaccine access. The vaccine ingredients are dried onto the patch or inside the projections, so they may be more resistant to temperature changes than a conventional liquid vaccine. Patches are also small, light, and much easier to administer, transport, and store. That could mean fewer syringes, less medical waste, and less dependence on refrigeration or trained health workers. Many respiratory infections and bacteria first enter the body through the moist surfaces lining our nose and airways. Injected vaccines are excellent at generating immune defences throughout the body, but nasal sprays and inhaled vaccines could build further protection directly at the place where some infections begin. Around here. Think of it as putting a security guard at the front door. By activating immune responses in the airways, these vaccines might help intercept a virus before it gets established. Researchers are investigating whether this could also reduce the amount of virus people shed, potentially making them less likely to pass an infection to someone else. Scientists are currently exploring respiratory vaccines against diseases including influenza, COVID-19, RSV, and tuberculosis. Swallowing a vaccine isn't science fiction. Oral vaccines against diseases including polio, cholera, rotavirus, and typhoid already exist and are regularly used today. Now researchers are investigating oral vaccines against a much wider range of diseases. The appeal is obvious. Pills don't require needles, and some formulations might be easier to distribute without highly trained staff or strict refrigeration. The problem is your stomach. Its job is to digest material, which is hardly ideal when that material is a vaccine. So, scientists are hard at work developing protective coatings, engineered bacteria, and tiny delivery particles that could shield vaccine ingredients until they reach immune cells in the gut. Some researchers are even experimenting with plants, such as lettuce, tomatoes, or rice, that have been engineered to produce vaccine antigens, the parts that trigger an immune response. Many vaccines must be kept within a carefully controlled temperature range from the factory all the way to the patient. This refrigerated network is called the cold chain, and maintaining it can be difficult and expensive, particularly in remote communities. Dry vaccines could remain stable for longer at higher temperatures. They could also be smaller and lighter, all factors which makes them easier to store and transport than liquid vaccines. And this technology could work together with many of the other technologies I've already mentioned, dried onto a patch, inhaled as a powder, sprayed into the nose, or swallowed in a capsule. One such vaccine already exists, the yellow fever vaccine, which is manufactured in freeze-dried form and reconstituted before injection. However, researchers are now attempting to develop a new generation of dry vaccines that remain stable at higher temperatures for longer periods and can be delivered in a wider variety of ways. Not all of these innovations are ready for widespread use. Scientists still need to prove that they are safe, effective, affordable, and practical at scale. But it relays a very important point: that the future of vaccines may not just be about inventing protection against more diseases. It must also be about making that protection easier to carry, easier to deliver, and easier for everyone to access. No needle required. If you found this helpful and want to understand the science behind the headlines and answers to the world's biggest health questions, hit that subscribe button and let us know your top vaccine questions down in the comments.